Good evening, everyone. Thank you so much for joining us tonight. My name is Christine Muir. I am the community librarian at Cary Library. I am recording this program, so if you want to watch it again, or if you know somebody who missed it and they want to watch it, we will be posting it to our YouTube channel, and I will send out that link once I get it posted up there. I am going to turn on live transcripts. So it will show captions at the bottom of the screen. If you find those distracting, you can click on the live transcript button and choose hide subtitles so that you don't see those if you don't need them. All of our programming at the library is supported through the donors to the Cary Library Foundation, so we appreciate their support in that way. We will have an opportunity for Q&A throughout the program or at the end. If you have a question for our presenter or for me or for Faith Parker, who will also be speaking briefly tonight, you can enter it into the chat. You can also raise your hand and I can call on you so that we aren't talking over each other, but then you can unmute yourself and ask your question verbally if you would like. So with that, I will turn this over to Faith Parker, who is the chair of Lexington Goes Purple. Here you go, Faith.
Thank you very much, Christine. I'm going to share my screen because I do have a few slides. Good evening. My name is Faith Parker, and I serve on the Massachusetts-New Hampshire board of the Alzheimer's Association, and I am chair of Lexington Goes Purple. Lexington Goes Purple is Lexington's annual awareness and fundraiser benefiting the Alzheimer's Association as part of their Longest Day program. The Longest Day is a do-it-yourself fundraiser in which individuals, groups, and communities across the country engage in activities of all kinds to raise awareness, raise funds, and to honor those caring for individuals with dementia. The event takes place on and around the longest day of the year, the summer solstice, and around the month of June, which is Brain Health Awareness Month. This year marks Lexington's 5th event, so you may have seen us in past years selling lemonade around Lexington Center and walking dogs dressed in purple. We have created coloring books for use in memory care facility activities and folded purple origami cranes. We have hosted concerts and talks like this one. Like last year, many of this year's activities are virtual. We are co-hosting this event, which is the first event of our season. It will be followed over the next few weeks by a virtual cooking class on June 9th, in which we are partnering with Two Aprons Cookery to produce a purple dinner, a virtual exercise class on June 11th in partnership with Artists Senior Living of Lexington, and a virtual bridge game in late June, in which we are again partnering with Family Friendly Bridge of Arlington. We have 2 ongoing activities. We invite you to sign up to display one of our lawn signs. We will deliver it to your home and you can display it throughout May and June to show your support. And we invite you to participate in this year's coloring and memory book project by submitting a black and white drawing that can be used in our annual coloring book or a personal story about your experience caring for a loved one with dementia. Our finished books are donated to Lexington's memory care facilities for use in their activity programs. On June 12th, our Purple Puppy Promenade will be back in person. Dress your pup in purple and join us at 9:30 a.m. in front of the Lexington Depot for a socially distanced walk around Lexington Center. Please follow us on Facebook and Instagram and our own website, bit.ly/LexPurple, to learn more about our activities throughout the coming weeks, to learn more about the work of the Alzheimer's Association, and to give your support. All the money we raise goes to support the Alzheimer's Association. Now I would like to introduce Dave Tasto and Eunice Bempong, RN, of Assisting Hands Home Care. Dave is the owner of Assisting Hands, Boston Northwest. He came to the home care field after a successful engineering career and holds a graduate degree and is a certified dementia practitioner. Eunice Bempong, RN, has over 10 years experience providing direct care to elders and she is a registered nurse at Assisting Hands Home Care. Take it away, Dave and Eunice.
Excellent. Thank you very much, Faith and Christine. We really appreciate it. And thank you to the collaboration between the Alzheimer's Association, the team at the Carey, the full team at the Carey Library, and our team at Assisting Hands Home Care, who helped pull this program together. Faith, Christine, and Inessa have been a joy to work with and are amazing resources for the town of Lexington. Again, I'm Dave Tasto. I'm joined by Eunice Bempong, our nurse, and we are honored to be kicking off Lexington Goes Purple this evening. Our two objectives this evening are to provide you specific actions that you can take to keep your loved one healthy at home, with an emphasis on caring for an individual living with dementia. Second, we want to help you take care of yourself by knowing which warning signs to watch out for, and then share information and resources on how to get support. Before diving into these specific items, we'll provide an introduction about myself and colleague Eunice, and then the talk will start with preparations for aging in place. I'll share some content from my book, Thriving at Home, which is intended for family caregivers, and it includes practical tips on what you can do to keep your loved one healthy at home. The second half of tonight's talk will focus on taking care of yourself, as I mentioned. And there are a few questions and polls during the program, but we'll leave plenty of time at the end to answer questions. Again, I'm the owner at Assisting Hands Home Care. We're based out of Bedford, just down the road. I did grow up in Minnesota, as Faith mentioned, moved out to Boston for college, studied in engineering and worked in engineering for a couple decades. But my entry into healthcare, and specifically home care, was through a personal experience. A few years back, my grandmother was diagnosed with dementia. She's here in the center of the photo here with my mom and my children. She moved in with my mom and stepdad, who became her primary caregivers. As the disease progressed, it became difficult for them to care for my grandmother at home, and eventually my grandmother moved into an assisted living community. She was able to get some extra support through hospice, and with the hospice benefit, caregivers helped her get cleaned up, dressed, and ready for breakfast each day. My mom called a few times from Minnesota and shared how happy she was with the care they provided my grandmother. For my mom, though, it made an otherwise very difficult time a bit easier. She had actually even mentioned at once that she could have probably kept mom at home if she could have had help like those caregivers provided. I was intrigued by these caregivers. I actually had a chance to meet them. I went back to Minnesota and met them at my grandma's funeral. They cared so much to come to her funeral, having only been with her for a few weeks, but what touched me were the stories they shared. They curled up her hair, as you can see in the photo here. They painted her fingernails, just going beyond the required tasks in getting ready for breakfast. What really inspired me, though, was a story one of the caregivers shared. Her own grandmother was going through a similar situation with dementia. That caregiver shared blouses with my grandmother and her grandmother. But my grandmother got to be she was so proud wearing her favorite new blouse. And this is in such a difficult time during hospice, towards the end, and just seeing that they went so far and above and beyond just really touched me. Even at that time, my grandma was probably smiling just as much as she is here in this photo. I'm grateful to have the opportunity to provide others that same level of care and consideration. And that experience, having met those caregivers, formed the basis of what we do, of why we do what we do in home care, considering the dignity and feelings of a care recipient, not just the task to accomplish. I would like to turn it over to Eunice now, who can give a little bit more about your background and experience in caring for others.
Thanks, Dave. Good evening, everyone. My name is Eunice Bempong. I am the clinical liaison registered nurse with Assisting Hands Home Care, and I am also a certified dementia practitioner. My journey into healthcare started really early on. I always knew that I wanted to help others, and so did most of my friends and family. They always highlighted how compassionate and empathetic I was, and so choosing nursing was a no-brainer for me. Through my 10 years experience working as a certified nurse assistant, I have actually worked with individuals who lived with dementia. I got to learn how individualized each person's situation was from the next. This really grew my passion into home care. Tonight, I want to apply some of the fresh ideas that I acquired through working with folks with dementia, as well as the knowledge that I have built through schooling to share some information which can be applied to help all of us stay and age in place. I hope that some information tonight will be new to you guys and will be helpful to apply to your own lives. Thank you so much for having us tonight.
Thank you, Eunice. All right, so we have a poll for our attendees. This is gonna be just a quick yes or no question to gauge your desire to age in place. This simply asks, do you and your loved one want to age in place?
This is Christine. For anyone who hasn't done a poll before, I see most of you have, so you're just jumping right in. But if you haven't, you can just select one of the radio buttons next to the choice you agree with. And in just a minute or so, I'll end the poll and share the results with you. I'm just going to give it 5 more seconds. I should also tell you all of the polls tonight are anonymous, so I only see the number of people who have responded. Okay, so I'm going to go ahead and end it, and I'll share the results with you, and I don't think you'll be surprised by them.
Right. Thank you. Yeah, so these results from our audience here in the Lexington area or wherever you're from is very in line and similar to what other national surveys show, basically showing about 9 in 10 want to live their retirement at home. Thank you, Christine. So our first objective today is to share some practical tips on how to keep you and your loved one thriving at home and out of the hospital. Home, though, has taken on a new meaning lately. This can be where we are living now, or in an independent living community or an assisted living. In home care, I've seen firsthand how individuals can age in place with the right support or plans. Maintaining and managing your health at home is critical for staying out of the hospital and rehab. I decided to write this book, Thriving at Home, for a few reasons. Hospital stays can be very difficult, expensive, and cause unintended consequences, complications, infections, or other issues. Particularly, though these days, I've seen that family caregivers are providing a lot of the support for loved ones. Although, similar to my mom, no dig on her at all, but no formal training necessarily in caring for someone, particularly with dementia. But meanwhile, some of us are handling household chores and the care for a loved one. And at the same time, many are caring for children or grandchildren and parents as more of like the sandwich generation. At Assisting Hands, our care team does a lot to keep individuals healthy. But many of these things can be done and are being done by family members. I wanted to share that knowledge with you, having the tools and interventions. Our loved ones will likely have better health outcomes and more happiness. So I wrote this book also because of the experience I shared with my grandmother to help folks like my mom who was not aware of support options at home. In fact, there were home care firms in the rural Minnesota town at that time. Finally, you can get a copy of Thriving at Home on my website. We'll share this at the end of the presentation through online bookstores and also at the Cary Library. All right, during this presentation, we'll cover some of the tips from the book on specific things you can do at home as well. All right, before Eunice and I give some specifics on caring for your loved one, let's step back a little bit and put things like home safety, managing aspects of your health at home a little bit into context. Having the ability to age in place does take some planning, and all plans should start with goals and objectives so that you know what you're going after. So outlining your goals is the first place, but the comprehensive plan to age in place should encompass a few additional elements as well. In looking at a few of these areas on the slide here, for example, in health and wellness goals, how do we want to make important health decisions? We'll need documents explaining this, like a healthcare proxy, something that all adults should have in place. For housing objectives, where do you want to reside and what style of living would you like? Do you want to live at home as long as possible, move into a community, or live with family? If it's at home, there could be modifications needed to your home to support your objectives. And for example, a consideration in your plan could include putting in a first floor bathroom to make it easier to access the bathroom as you age. A travel objective could be that you want to visit family in Connecticut this year, or each year, excuse me. And the transportation element of the plan will need to cover this. How do you get to Connecticut later during retirement when you may not be driving on your own? Is just one of the considerations that we might have to have in our plan. For each of these elements, there will be certain considerations that will need to be addressed, and you'll need to assess which of these you can manage with your spouse and what areas you'll need help with. No need to copy everything down on the slide here today. We're gonna send out the slides after the presentation this evening, but just want to put it a little bit in context. One thing missing though from some plans that I have seen is that we do need to consider what happens if there is a health crisis for the primary caregiver. So having a part of the plan include caring for the caregiver and maybe a current care recipient at the same time could prove invaluable, right? And that's what a plan is, kind of considering all the different scenarios. Not that it has to be just so detailed, but I just wanted to open up and broaden the perspective. And some of the things we talk about tonight tie into the plan for aging in place. All right, now on to some specifics that you can do to keep your loved one healthy and out of the hospital. The number one reason older adults go to the hospital is because of a trip or a fall. The good news though is that most falls are preventable. To help prevent falls though, first we need to identify hazards. Things that could cause us to trip and fall down. To identify those hazards though, it requires proper lighting, appropriate levels of light that will allow us to see those hazards. And ideally, rooms are also illuminated upon entering, like through a light switch, not after walking into the room and then turning on the lamp, because there could be a pet running across the floor. There could be something else in the way that we need to see. Also, as we age, our eyesight changes. In order to see these hazards, we'll need to have our eyes checked regularly. So remember to visit your eye doctor. Again, this is all in support of preventing the number one reason of going to the hospital is just preventing the trips or the falls. After identifying these hazards, we need to remove the hazards from the home. And I would recommend paying close attention to rugs. Throw rugs typically are problematic, or uneven floor transitions. They can also cause trips. In the graphic here on the right on the screen, the bedroom area is tidied up, and I know it's just a graphical depiction of a bedroom here, but the bedroom area is tidied up with no loose rugs or cords on the floor or on the floor across the walkways, particularly between the bed and the bathroom for overnight needs to visit the bathroom, when the lighting could be dim. Additionally, I recommend using supportive equipment. Grab bars can be installed in bathrooms, up in the top left here in the diagram, near the toilet, also in the bath or shower area, where you'll need to raise and lower your body, or adjust your center of gravity, getting in or out of the tub, for example. In areas where floors can be slippery, have towels around to wipe up any water or spills that might happen. Like the bathroom or kitchen, the spills can happen in the bathroom, the kitchen, when you're preparing meals or washing hands. Also, in terms of supportive equipment, on the bottom right, though, there's the stairwell. Having rails on both sides of the stairs or even lifts, right, is helpful should your condition result in having a stronger side, as is often the case with a stroke. But I would say continuing to do as much as possible at home is critical to maintaining your independence. Even if walking with a walker is safer, that is better than not walking. And we get the fear of falling, after we've fallen once maybe. But I encourage all of us to continue staying active as much as possible. It's so helpful for your health. Retaining your strength and balance is part of the staying active, but it's also critical to ensure the ability to move around the home. Specifically exercise, is very important to stay strong and will also help reduce the risk of falling. Often these days, many exercise programs are available through video calls. Councils on Aging or senior centers have programs available. And video, they're easily accessible from any location. Now, moving on to individuals living with dementia and those hazards that they might encounter. A good practice is to review the home, trying to look at everything from that person's perspective. If we look in the kitchen, for example, a safety review can assess where the cleaning chemicals are stored, safety around the oven or gas stove, or other cooking hazards. Before wandering is a concern, door locks and alarms can be very helpful, as well as locks to avoid medication issues and help ensure that medications are administered appropriately, the time of day, the day of the week, and so forth. So there are a number of simple things that you can do at home to keep your environment safer. We're only touching on a few of these key areas, but the book Thriving at Home does contain some additional tips as well. I've covered a lot in this one slide, and I just want to open it up. If there's any questions, we can take some questions now. Give me a chance to get a little water too.
I don't see any raised hands or anything in chat. But as a reminder, if you do have a question at any point, you can put it into chat and we will address it, when we have some time to do so, whether it's right during the same slide or whether it's at the end of the program. So feel free to use that whenever you like.
All right. If no questions, we'll keep moving, okay?
Yep.
Eunice, could you take over?
Absolutely. So in addition to identifying how we can keep our home safe, there are also many conditions that can be attributed as key drivers for individuals to go back to the hospital or the emergency room. And so even though we're talking about dementia specifically, we want to also highlight some of these conditions. These may include, but not limited to, diabetes mellitus, heart failure, chronic obstructive pulmonary, also known as COPD, as well as stroke. And these conditions, if not properly understood and managed, can cause repeated avoidable trips back to the hospital. And with individuals living with cognitive decline as pertains to dementia, these trips can be not only overwhelming, but also very confusing. Therefore, we can help taper down some of these avoidable trips back to the hospital. Well, first of all, we need to understand the disease process and how our lifestyle modification can improve these symptoms and keep us in control of these conditions. So for example, if the chronic condition that you have is diabetes mellitus, you typically will have two main problems, which is either you have hypoglycemia, which is when the blood sugar goes too low, or you have hyperglycemia, which is the opposite, when the blood sugar goes too high. And so simply identifying some lifestyle modifications, such as cutting on certain, high glycemic index foods, which is a fancy way of saying foods that are easily digestible and also high in sugar, can help us decrease and help us stay in control of our symptoms. And then also keeping a logbook can be very helpful in tracking the disease progression as well as improvement. We want to see the disease is getting better. If it's getting worse, are we able to stay in control of our symptoms? And this can be a very helpful tool when you go to the healthcare provider, because they will be able to make recommendations as to whether or not what they initially proposed is working or it's not working. That way they can make changes. Again, these logbooks can help you generate meaningful questions when you go to see a healthcare provider. So for example, if you're checking your blood sugar and you're documenting it, you would just, by looking at the logbook, be able to identify when is the blood pressure high? Is it in the mornings? What contributes to that being the case? And this can be very helpful in managing chronic conditions as pertains to heart, conditions or stroke or COPD and diabetes. Similarly, we can identify abnormal symptoms logging. So for example, we always say that pain is a sit vital sign. So if you're in pain where it's affecting your everyday life, it's definitely a reason to go back to the hospital or to report to your healthcare provider. So in as much as we're trying to stay out of the hospital, not negating the fact that there are times when the hospital is necessary, we want to make sure that we understand that we have to go back to the hospital when we're not able to control our symptoms or our abnormal symptoms presents itself.
Thank you, Eunice. Thank you. Well, after monitoring for and controlling most symptoms and pain at home, there can be symptoms that are not manageable, as she was saying, and knowing when to go is very important. But also knowing that it's okay to go is very helpful as well. For our next poll, how many of you have had a loved one go to the hospital in the last year or so?
So just like with the last poll, this one is anonymous and you can only choose one answer. It's a pretty simple yes or no question. And I'll just give it a few more seconds. People are well versed in these polls. This is fantastic. So at the moment, it's a fairly even split. I'm just going to give it 3 more seconds. And I will end it. And now I'll share the results with you. So you can see it's pretty well split.
But yeah, still half, right? Half folks have had a loved one go to the hospital. So some of these could have been just quick checkouts in the emergency room, and a quick return home. Others may have been extended stays at the hospital. These trips, should not be avoided when needed, as hospitals can provide the best care available. And they should not, as we said, not be thought of as a last resort. Again, having an understanding of which symptoms may be managed at home is critical, but also which symptoms do need insight from a healthcare provider. These are both key to knowing if you should go or not. All right. So speaking of going, hospital trips, did you know that 1 in 5 Medicare patients go back to the hospital within just 30 days of leaving? So just in 1 month, 20% of Medicare patients return to the hospital. Based on our poll, some of us have already had a recent trip to the hospital. in the last 1 or 2 years, right? But just that initial trip, though, does make a return trip much more likely. We'll cover a few things to help reduce the likelihood that you'll need to go back, right? Planning for trips to the emergency room or hospital and knowing what is needed upon leaving, those are two key pieces and critical elements of a comprehensive aging in place plan. In preparing for a trip, you can surely make the experience much more positive and help set up for a better outcome. And that's what I'll go through right now. So when thinking about what is needed when you're going to the hospital, a few things, come to mind here. The documentation that a hospital staff will need to know. For example, insurance information and a medication list, particularly for folks living with dementia or Parkinson's, having a medication list that includes the times of days, as I mentioned earlier, is critical for a smooth adjustment into the hospital, where the hospital staff will take over all medications while you're in the hospital. Also, while at the hospital, who will make those health-related decisions for your loved one if they're not able to? As I mentioned earlier, we need that healthcare proxy in place, and we need to bring this with us to the hospital. In addition, though, our wishes for life-saving techniques is a MOLST. This document is called a MOLST, a Medical Order for Life-Saving Techniques, which is basically a new document that includes additional wishes to the Do Not Resuscitate or DNR form that most of us might be familiar with. These are great things to keep right on your fridge with other medical information like your medication list and so forth. Emergency personnel like EMTs or folks in the ambulance do look on the fridge for these documents when they arrive at the home. As much as we don't know when we'll need to go to the hospital, okay, so we're talking about preparing, but we don't know when we're going to go, so you have to have things in place for when you might go. We also don't know how long we'll be there, right? So bringing communication devices like a cell phone or tablet computer can be very useful to stay in touch with family and friends, as they're going to all want to know how you're doing. These devices are particularly important these days when visitation restrictions are in place. Certain, only 1 hour a day, 1 hour, during a day might be the allowed visitation. You could also consider bringing hobby activities like books or puzzles to pass the time as well. Eunice, could you please speak to advocating while at the hospital based on your experience working there, but and also what to know when leaving the hospital?
Absolutely. So staying healthy is definitely a collaborative effort between teams of healthcare workers, primary care provider, nurses, speech pathologists, as well as you as the main decision maker. So you can advocate for yourself what you think, the right steps are when it comes to your health. Therefore, it's important that before we leave the hospital, we're comfortable with what the next steps are, especially when it comes to new diagnoses that you're not familiar with. So in this case, you would require further teaching, whether or not you would need a specialist involvement. These are all critical information that we need to be very much aware of before we leave the hospital. With my experience working in the emergency room, we always send patients home with printed paperwork that has lots of useful information that can help you maintain your health outside of the hospital. And sometimes I personally use colored highlighters to identify, what the next steps are, who the specialist is that you have to see and when you have to see them, whether it's going to be 2 or 3 days time that you have to follow up. Because I do understand that some of this information might be a lot and overwhelming for you to take in. But it is still very important that if you're getting all this information, you ask all the necessary questions, make sure that you completely and fully understand what you're supposed to do, whether you have to cut back on some lifestyle choices, food modification, whether you have to start, some exercise program, physical therapy, and the likes. So this is very, very important time when you're leaving the hospital, as much as it is when you're coming into the hospital, that you gather all the necessary information before you leave. And healthcare workers are always willing to provide all the answers before you head out. But then again, when you follow up with your primary care, you should definitely have all the questions that you had prior to going to the hospital. You should have it all addressed before you head out.
Thank you, Eunice.
Yeah.
That's great. There are many studies that prove minding all the details upon leaving a hospital or rehab, will help you prevent a return trip. We have a little bit of a section break here. I just wanted to see if we can open it up for questions. We're going to transition now from more caring and things that you can do for a loved one. And the next section we're going to transition into is going to be more about taking care of yourself as a care partner. So before we transition, is there anything, any questions that we can answer right now, or we can save them to the end?
Dave, we did get a question in chat about when is the best time to do the home evaluation. Is it better to do that before you need it, or do you have any recommendations on when somebody does that?
Yeah, I can add something, but Eunice, feel free to join as well. But you can't over-assess hazards, I don't feel. So I think that looking today, tomorrow on hazards around the home that could run into, definitely before you realize there is a problem, is really, it's like more of an ounce of prevention is worth a pound of cure in this case. So it's definitely good to look for hazards, before they become a hazard in a sense.
And does it make sense to repeat the evaluation if something changes in the situation? Like, suppose after you've had one fall, you maybe want to take a second look at the house and see how that's changed your ability to move around within it?
For sure. Exactly. Reassess. I mean, it could be, you might have addressed the uneven floor transition before, but that might have caused the trip, but it could be a different hazard the next time. And often, as I mentioned about the eyesight, it can degrade over time as we age, which is normal. But if something wasn't a hazard before, it might now be a hazard only because we're not able to see certain things, or we can't distinguish as much of the contrasts in a room possibly.
And if I can add in too. For example, if you have a disease progression, right? So something like dementia, it's a progressive, disease. And so as it gets worse, obviously you have to make more modifications to accommodate, your new lifestyle. So things that are around the home that used to be okay to have around the home, they might obviously become hazards. So for example, you might have pets that you will not be able to see very closely because of, failing eyesight. So those might have to be, given to family members just because they could, cause some trips when you don't have perfect eyesight like you did years before. So just, the disease progression can cause you to have to make modification to your home.
Excellent.
And we have a second question, more related to the hospitalizations. If somebody lives by themselves or doesn't have family nearby, what kinds of services or caregivers might be available to accompany a person on follow-up appointments or help with errands while they're recuperating at home? Or, if you don't have family nearby, what other resources does somebody have?
That's a perfect question and a piece of what we're going to cover coming up. Talking about, what, not just a break, but if you do need extra support and how, other resources in the community or home care firms can support some of those things. That's great. We'll address that question in the next couple slides.
Great. Thank you.
Excellent. All right. So to start this next section, we're going to have another poll. This time it's more to understand what types of situations our attendees are finding yourselves in at home. The situations can be related to the condition of your loved one or the environment at home. We want to know like all of the activities or area you're helping with and the areas that you might be able to need some help. Thinking of these will also help set up the next couple slides as well. So take some time. There's a little bit more. This is I don't know if you want to explain a little bit, Christine.
Yeah, this is a little bit of a more complicated poll. We were testing you on polls 1 and 2. Well, we were easing you into it. This is the test. So on this one, you can choose more than one option. So if you have multiple concerns for your loved one, you can select as many as are relevant to you. And I will give a little bit extra time because you can have some extras. And Dave, maybe because I think we have sundowning listed, and this was not a phrase I was familiar with. If you want to explain that while people are giving some answers, we can let this run a little bit longer.
Sounds great. So sundowning, the term sundowning can affect individuals living with dementia. It refers to a state of confusion occurring in the late afternoon and spanning into the night. Sundowning can cause a variety of behaviors such as confusion, anxiety, aggression, or even like ignoring directions. So it can be common as well. You might run into this.
And when I first met with Dave and Eunice, I was thinking about how when my kids were toddlers, we called it the witching hour. There was that hour in the afternoon when they were too tired to be cooperative, but still had enough energy to be a little, I don't want to say argumentative, but there's a period in the day when toddlers, some of you may remember this phase, when toddlers are a little more challenging just because of the time of day. And so sundowning is kind of comparable on the other end of the scale. So we have 75% of our attendees have voted on this one. I'm going to go ahead and end it, and I'll share the results with you. There are a lot more choices in this one, so I'll talk through them a little bit. Driving and transportation and preventing burnout are the two most common. They both had 83%. And then sundowning, overnight, risk of falls, medication, and cooking were the other big ones. Upcoming surgery, thankfully for this audience, is not as big a concern. So I think that's probably a positive thing for those of you with us tonight. So Dave, I know you're going to build some of your content off of this. I don't know if you want another minute to look at that, or if you're...
No, that's great. Thank you.
Of course.
Yeah, driving and transportation, I think, is one of the questions that was alluded to earlier, in terms of what type of support you can get. But yes, that is is a big piece of the plan for aging in place. For example, on this thing, just looking at a couple of these things. So reducing, risk of falls. Looks like a few attendees have, almost more than half have selected that. We have a client with cognitive challenges who simply forgets to use the walker. En route to the bathroom, just had a near fall incident. Things can be done in these conditions to reduce that risk. For example, like placing the walker in a visible, convenient location that will prompt the use. That kind of an approach can just help a lot. But situations like these or others are very common and come up often. Eunice, would you want to, I don't know if something sticks out to you. Is there something you would want to mention or highlight?
Yes, I wanted to talk briefly on family conflict. I actually experienced that as a private home care, certified home care assistant. So this happens a lot when family members, so say parents, are being instructed on medical, concerns with their children. They still don't value, it coming from their children because they still perceive them as a child. But coming from a healthcare professional, they normally would be able to more accept it and probably adhere to those instructions versus hearing it from their son or daughter who is now telling mom or dad what to do and what not to do. So this can be very interesting when, either as a CNA, you're in the middle of, such a family conflict and you just have to explain to mom or dad that what their son or daughter is saying is actually accurate.
We'll touch on, thanks Eunice, we'll touch on, preventing the caregiver burnout, which is, over 80% of the attendees. Also, overnight, issues, or it seems that some of you are having difficulty at night or having wake ups during the night. you know, and I think we're going to cover some more of that in terms of the warning signs in a slide. But it does seem that, you know, based on the results that, you know, many of you are probably having more than one of these issues that in the situations that you're experiencing. And the next slides are going to focus on identifying the need for help and then getting that help for the care partner. All right, so now we're shifting over to Eunice to speak to some of the warning signs.
Thanks, Dave. So as Dave said, this slide is actually dedicated to the family caregiver. When do you know it's time for you to seek help? Well, when you notice some of these warning signs, it's time to definitely get help. Some of these warning signs might include exhaustion or burnout, as it was identified in the previous poll, fatigue and isolation. You're not just having time to mingle with anybody else other than your loved one that you're taking care of. This could be repeated hospital trips, or sometimes some family caregivers just resort to pushing more medications as a way to just alleviate that burnout they're experiencing. It could also be extreme emotions such as emotional labor and depression. It could be increased anxiety or anger, even towards the sick loved one. Could also show up in a form of self-neglect where you don't have time to engage in things that maintain your dignity as a person, like having time to eat enough or not sleeping enough or sleeping too much, forgetting, you know, to do things that keep you and your mental health safe, having inability to focus, forgetting, and word finding. These are all things that can let you know that it's time to seek help. And it should be okay to know that it's time to seek help. And so on the next slide, Dave is going to be identifying some, you know, tools that can equip us to be able to deal with the burnout and the exhaustion that we might feel as a family caregiver.
Thanks, Eunice. You know, as we do in airplanes, you know, if there's an accident or something, we also need to do at home, and that's put on our own oxygen mask first, so to speak, to then be able to care effectively for our loved one. So we have to have our own health in place before we can very effectively or efficiently help another person. There are a few priorities for self-care on the left here. And on the right are the approaches, as Eunice was mentioning, or options, you know, that we can pursue to help address our own mental, physical, or emotional health. Connecting the priorities on the left with the items or approaches on the right can help us specifically address what is needed in our situation. So based on the warning signs that you noted on the last slide, you can start addressing those as priorities for your own health. As an example, a few items I can highlight kind of quickly that can directly improve mental health. So we look at mental health on the left as a priority. On the right, you know, we see meditation, attending support groups, therapy, or for some of us, going to religious services can help ground us. Also, it's known that physical exercise and walks can even improve our mental health as well as the physical health. To take care of yourself, sometimes you just need to take a break from, you know, for the physical and emotional drain that we get from being a caregiver. We'll talk more about getting a break on the next slide. But it's okay to take time just to speak with friends, do some reading, gardening, researching on the internet, engaging in any of your hobbies. These can all help recharge your batteries and keep you in good health or good spirits. Again, visiting your doctor and attending your healthcare appointments are important for maintaining your health. You know, these appointments are needed, not just for our loved ones, right? But for you, you know, the stronger and healthier you are, the better you can support others. Think of the items on the right, I think, you know, Eunice was mentioning it, more as tools in your toolbox to help maintain your personal wellness. So we've seen earlier all of the situations that you're finding yourselves in, and there's probably many more that weren't even on that list. And many of you are likely experiencing, one or more of the warning signs that outside help is needed. We have a client at Assisting Hands where the primary caregiver was his wife for many years. She was supporting his needs while also running her own business. But as her husband's health deteriorated and the dementia progressed, she explained how she was so exhausted. The support they received allowed her to get out, have a break. I even remember her saying how she was so happy just getting her hair done, and not also have to always feel like the caregiver. She was able to be her husband's wife again. That's the beauty of respite care. Right? Respite care is really a break for the care partner, and it can take many forms. And often in home care, this is sometimes a way in to help support folks who are a bit more resistant to getting help. And we can talk about the support coming in as for, the caregiver, for a break for the caregiver. She's, he or she is coming in to help me, the caregiver, out, is a way to look at it. Often, though, respite comes from a family member, a friend, just offering to give you a break. My advice, though, is if they offer, accept it. Or if you have to, though, just ask for help. This is communities like assisted living residences or nursing homes can provide short stays for a number of nights. For example, if the care partner goes on a vacation, a family vacation. There are also certain adult day programs that can give you a break. Some of these, actually closed down during the pandemic, but I just heard today about another one opening back up. The Council on Aging in your town is a great resource. There are regional elder services or senior service organizations you can speak with for additional information. In our area, this would be Minuteman Senior Services, which is also based in Bedford. Remember to ask for help within your network. Or as I mentioned a moment ago, even if your friends or family members do not offer, just ask them for some help. Often you'll get that help. Also, though, private help is available. There are care managers, home care firms as well, who can provide assistance and give you that break. And we'll talk a little bit more about how home care might help. But speaking of resources and help available, here are some local resources for you in the town of Lexington and in the local area. Many of you are already seeking out information, have already connected with great resources at in the Carey Library and the Alzheimer's Association. No need to copy all these numbers down. Again, we'll provide a copy of the slides to you, along with additional information that Christine will send out to all the attendees. Eunice, can you explain a little bit more about what home care is and how it could help?
Absolutely. So home care, I just want to define that briefly. It's a non-medical support for activities of daily living, which includes bathing and helping with meal prep and keeping the home safe and things like that. That should not be confused with nurses coming into the home. That's a different version of home care. But the home care we're identifying in this context is non-medical support. So home care can provide a wide variety of services to help with some challenging aspects of everyday life due to disease progression or just the aging process. So home care can help with leisure activities. So for example, if you like to go golfing or you want to just go out for a coffee, a home care personnel can support in that area. It can also help with identifying hazards that we may not otherwise see because that's our home and we're probably used to it. So somebody coming in with fresh eyes will be able to identify those hazards and be able to have meaningful support in those areas. Home care can also be helpful in keeping up with the things, keeping up with our household, such as dusting around and gardening and the likes. It can be helpful in promoting safety with getting around our home. So as we get older, sometimes our ambulation gets affected where we're not able to safely, move around the house. So a home care person can be able to support in that area as well. Again, it can be helpful with grooming and personal needs, having your hair trimmed in the house or having your hair washed, things like that. It can also be very helpful with medication reminders. Sometimes people, as we get older or due to cognitive decline, we may forget when and what time to take which medications. So this can be very helpful, as well as for transportation. I think there was a question about that in the chart. So home care can be helpful with helping you to and from your doctor's appointments or just visiting with family if you just need someone to provide that support. It can also be very helpful with respite, as Dave highlighted in the previous slide, where it gives the primary family member care partner some break to take care of themselves as well. It can be also helpful with monitoring and tracking disease progression or improvement, which is a very great, tool as part of home care. But we want to make sure that we highlight that home care services are there to support the areas that we are, independent in, and to help with the areas that we have weakness. So it's not to take over your life as an individual, but it's supposed to help you to maintain that independence while supporting the areas that you're not able to provide support for yourself otherwise.
Thank you. So how to get that extra help? We wanted to provide some pointers for you on what to do, what to look for, what to ask, and so forth. I strongly recommend reaching out before an emergency, right, to develop relationships with firms that you may need help with to age in place. Again, this includes all types of support in your plan, including legal, financial, or other types of support. When you can evaluate services or offerings while not in a crisis, you have a better perspective on seeing if the firm's approach is a match for you, your loved one, and your expected needs into the future. But if getting some extra support at home is part of your plan, there are some specific things we would recommend looking for. We are focused on thriving at home, and to us that there's a few key items here. Having qualified, well-matched caregivers to your particular situation, personality, and interests. Today these are kind of like table stakes. These are basics that you should just expect. You can ask on these ones and just ask about their hiring process and how they interview or screen for new employees to get a feel for the qualifications. Smooth care transitions, as we discussed at length, the importance of the transitions, to and from a hospital or a rehab facility. As we saw in the poll results earlier, it's likely that a trip to the hospital will be needed during your retirement years. About a half of us, had a trip. Half of attendees had a trip for their loved one in the last year or so. You very much want to be, in good hands when it comes time or when it's important to mind all of the details for those transitions, right? So when you're in the middle of the transition and you have a day or two, before you're discharging home, that's a little bit fast. You want to try to prepare. If you have an upcoming surgery, that's the time to start planning for what's coming. We also spoke about maintaining, and Eunice just mentioned it again, how important it is to maintain your independence. Getting assistance where it's needed, but not getting support for everything. Not that it can't, you can't be catered and we can do a lot of things for you, but we want to encourage your loved one or you to do what you're able to do and support, what you're not able to. But that should kind of be the philosophy as well of the firm you're looking at. Be sure to ask as well, though, about the training and oversight caregivers receive. Often giving care is done by loving family members, but when professional caregivers are needed, you want to know they have the experience and have been trained on the aspects related to the care being provided. Specifically the dementia care training is important, as well as like infectious disease protocols and falls prevention. As we've discussed earlier, you want to know everything is being done to prevent a trip to the hospital. Additionally, communication across the healthcare continuum is critical, both with other healthcare providers and with other family members. Question could be, does the firm have a single point of contact? For us, we call it an internal, like a care advocate, but a single point of contact on the team who can help coordinate with other healthcare partners or provide updates as needed. Regarding technology, these days you can expect real-time or daily updates for family members. Asking about technology, or this question will really get at how the firm embraces technology to help manage the quality of care. Having those accessible, like online in a secure environment, the care notes after each shift on how mom or dad or a spouse is doing is very helpful to ease the burden on the primary caregiver. Again, this primary caregiver who has enough to do just in caring for their loved one without having to be the communications conduit for the other family members looking for an update. It's just a double burden that with technology these days, you shouldn't have to have that burden on the primary caregiver. The book Thriving at Home does include 10 specific questions to ask, if you're meeting with a firm to understand if that firm is a fit for you. All right. It's my hope, our hope, that you've learned something new this evening. I'll summarize a few key points here, though, to recap. First, to help avoid that initial trip to the hospital, identify and remove safety or trip hazards from your home. I would say second, learn more on how to manage your or your loved one's health at home. It will help you know when you need to escalate and when you need to go to the hospital. Lastly, I would say is ask for help. Caring for a loved one with dementia, can be a lot. It's a team effort. Be okay, having others help because you're worth it, and both you and your loved one will benefit if you are healthy as well. So again, thank you very much for joining us this evening. Hopefully you've captured some actions that you can take to keep yourself or your loved one healthy and happy at home. I also know that I also hope that you're aware of some warning signs and know now what you can do to get extra help. Here are a few places on this slide here that can be more information. To find out more about my book or buy a copy of Thriving at Home, the website is there, thrivingathomehealth.com. Additionally, contact information for us at Assisting Hands Home Care. And do remember the Alzheimer's Association helpline and website for more information there. Christine, I don't know if you wanted to take it away from there.
Sure. So we have another question in chat, and I'll just invite people again, now that you've had a few minutes to kind of absorb all the information. If you have any other questions, you can put them into chat, or you can either raise your hand or unmute yourself. And if you want to ask your question out loud, I'll just call on people so that we don't talk over each other. That's worked well in other programs in the past. So feel free if you have a question, or we actually have a tip in chat. So if anybody else has something they want to share that might help another person, that is welcome also. The question that's in chat, and I don't know if you'll know the answer to this, but are medication dispensers and reminder units covered by Medicare?
I don't know. Eunice, do you know?
No, they're not covered by insurance. I think that typically they would rather have a visiting nurse oversee it rather than have, a dispenser. So yeah,
And
unfortunately.
would a visiting nurse be covered completely by insurance? I mean, you can understand where the question's coming from, right? Costs are going to multiply.
Right. Right. So it's dependent on the condition that the person has. So there are certain chronic conditions, especially if it's brand new. And there's other, factors like cognitive decline. If the person doesn't have any individual that can supervise, their medication, the doctor might be able to collaborate with the emergency room to recommend a visiting nurse for a while, to provide education with the medication changes and administration for a while. But again, it's just for temporary, time where the person will be able to learn how to manage it on their own, and then it's discharged from the program.
I've had very good luck with my healthcare provider, not in these particular situations, but knowing what the costs would be or what would be covered by insurance. And in a recent visit, I had to get an inhaler, and I said to the provider, I don't want to spend hundreds of dollars on an inhaler that's going to expire at some point. And she very kindly said to me, I've written the prescription. If it costs more than you want to spend on it, come back to me and I'll find an alternative. So I think this is a fair question to ask a healthcare provider. I thought her response was perfect. That's what I would like to see all of them do, because sometimes it's not a question of what you can afford, but where you want to spend your dollars. So I really liked her response to me on that. So the tip that came up in chat is for the person who asked a question about having help with running errands or transportation or follow-up appointments. Somebody says that they are familiar with an organization called Neighbor Brigade, which is a volunteer unit that's only for short-term needs, but they might be able to help with transportation to a hospital. Because it's all volunteers, it doesn't mean every request can necessarily be filled, but that is a good option to look for. So Neighbor Brigade. And I don't know if that's necessarily available in Lexington or if the person who offered that lives someplace else, but it is something to look for that may be a nice free option for some assistance, especially in a short-term case. And it does depend on the town. So it's not everywhere.
That's great. Great tip.
I don't see any other questions, but I will invite Faith to come back on screen if she would like to share anything. Dave, if you want to stop sharing your video, then Faith and I will come back on screen. Sorry, this screen keeps jumping on me. So the menu option I was trying to get to just jumped, so I couldn't get to it. Faith, is there anything that you would like to add, or any questions you'd like to offer?
I think just one tip I would like to provide, particularly since the topic is for folks caring for people with dementia, is that the Alzheimer's Association 800 number is staffed 24 hours a day, 7 days a week with trained social workers, live people who will be able to answer your questions and will be able to refer you to resources in your area to help with services, provide you with advice, so they can be a great resource to get all kinds of questions like this answered. And I just want to thank Dave and Eunice for a great program, and we really appreciate your kicking off Lexington Goes Purple, and really hope to see everyone who attended tonight at another Lexington Goes Purple event or with a lawn sign in your front yard over the next several weeks. So thank you very much.
Well, thank you, Faith and Christine. We very much appreciate it.
Thank you to Dave and Eunice and Faith for being here tonight. And thanks to everyone who attended. As I mentioned at the beginning, I did record this, and so I will share a link to the video once I put it up on the library's YouTube channel. And once it's up, you can share it with anybody else that you think might find it helpful. I will also send some resources that were offered tonight And somebody just added the Neighbor Brigade website into the chat. So I will include that in the resources that go out as well. So you'll have a list of different phone numbers and organizations, mostly in the Lexington area, but I do think it covers Middlesex County pretty extensively. So, and then of course, Alzheimer's Association is national. So you'll have some resources that you can reach out to. And I just would like to echo that it's okay to ask for help if you're a caregiver and you're doing the best that you can for your loved one. Don't forget to take care of yourself. That is really important, and it is okay to do that. It does not mean that you are shirking responsibilities or cheating your loved one out of anything if you say, I just need to go get a massage or take a run or something. You know, you can't save somebody if you're not okay yourself. So ask for help. Thank you again for attending, and I will be sending out an email shortly. Have a great night, everyone.
Good night.
You too. Bye.
Thank you.